Good evening, everyone. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hyperpigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to a recent data, almost 80% of people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer. The faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For this, today we have Dr. Uzzaif Mansuri, a consultant dermatologist from Ahmedabad, live with us to educate us more on acne management. Dr. Mansuri is MD Skin and VD, running two branches successfully in Ahmedabad. Doctor has more than 10 years of experience in the field of dermatology. He is known for different kinds of medical and cosmetic treatments in Ahmedabad. His area of interest includes Botox, thread lift, hair transplant, laser hair removal, physiotherapy, acne scar management, and many more. With his expertise in today's topic, Doctor will enlighten us on management of acne. A very good evening to you, Dr. Mansuri. Hope you are doing good, sir.
Yeah, I'm doing very good. And thank you very much for bringing me on this platform.
Doctor, today we are going to talk about acne management. And first of all, we would like to ask you, what is acne? What causes acne?
Acne are generally caused by mainly hormones. The glands of the acne, the hormones acts on the glands of the acne, and the hormones make the secretion of the glands faster. And sometimes they get blocked by the dead skin or dust, or the secretion by the hormone is more. This may lead to acne. One of the main reason of this is that, and this occurs because of changes in the hormones which occurs during the age of the puberty. And it starts from the age of 10, 11, 12 years, and it more common at 20 to 21 years, 25 years of age, but it can occur at any age.
Right. As you very well said, as it is most, commonly caused due to the hormonal imbalance. It's during puberty or adolescence that a person goes through this phase of acne breakouts, etc. Now, but many times, people in their 30s or late 30s, they are also coming to the doctor and saying that, I am having these acne outbreaks and I never had it before. But now they all have these acne outbreaks. So, does acne really occurs in old age as well?
Yeah. Very commonly acne occurs at 30s also, but at that age, the reason may be different. Like suppose someone gets diagnosed with a thyroid, then the patient and or someone will have to take the thyroid hormone. Now the thyroid hormone gets makes you have acne. Along with suppose someone needs to take some oral contraceptive pill or some hormonal tablets or something for any reason, so they also causes the acne. So there are many reasons. During pregnancy many people get acne, after pregnancy many people get acne, so there are many other reasons, and also there are many medicines which also causes acne, but sometimes that medicines are required and they should be taken, but along with that we can take care of the acne.
Right. And many a times when the weather changes, right, when this transition period is there, that time also people complain of acne breakouts and they'll say that, heat is making me have these acnes or weather change, etc., is affecting my skin and acne breakouts are, troubling us. So can heat cause acne breakouts, doctor, or does acne specific to any season or occurs throughout the year?
Acne occurs throughout the years, but in different season, and the acne occurs. with different reasons. Like for example, in heat, you might be having sweating, as a result of which dust pollution they start accumulates on your face. Then there are more chance of getting an infection, and so in the during heat you can get acne because of that. Right. And sometimes during in raining season, and as because of the rain, in sometimes you have to go in the rain. Then because of that, you might get dandruff, a lot of dandruff in the scalp. And if you get a dandruff in the scalp, then you get a lot of acne on the forehead. So sometimes when there are only acne in the forehead, the reason is because of excessive dandruff or dandruff in the scalp. So in monsoon season, you can get because of that. And in winter season, though the acne are less because there is dryness, but there are also chances that the dryness can also lead to acne. So it is not related to a specific season, though different season, in some season it may be more, some may be less.
Fair enough. And doctor, as you said, how sweat can also, act as a cause for acne breakouts. It reminds me of how mask has become new normal for all of us. And when we wear those masks, again, we see a lot of acne happening, behind that. What's the reason for that?
Yeah, so the reason for mask, and now it is called the mask acne. The very cleanliness of the mask is one of the issue. Many people, it is a disposable mask, but people wear it again and again. Plus the material of the mask from the inside, it get rubs on your skin in, so it may lead to spreading of the acne or damage the already present acne, which may lead to lot of marks. Plus the circulation of air is little bit affected, so the acne may worsen. So these are the reason because of which the mask causes acne.
Okay. And doctor, as we, keep on saying that prevention is always better than cure, is there any way to prevent acne breakouts?
Prevention is very, very and always better than cure, especially in the skin and hair condition. And you will always like to have your car regularly maintained and everything, rather than you will just have your car spoil and then you will go and then repair it. So prevention is the best thing. Right? So the prevention start with one important thing in during in very early ages. So like people think that if they apply like home remedies, or if they go on YouTube and everything and they will hear them and then they will start this, so their acne will get healed or they won't get acne. So everyone should take a professional dermatologist advice that how is their skin. If whenever they start to get a single acne, or they should take an professional advice to know that what should they apply, what should they do, what should not they do, what are the things that they are doing is wrong. Just before 10 minutes, I got a patient and I asked them that, okay, what are you doing? Anything on face which should not do? No, 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 we are not doing anything on our face which should harm us. Then I specifically asked them, okay, what are you applying on the face? Then they started, okay, I'm applying Vaseline, I'm applying honey, I'm applying pure aloe vera. So these are the things which can lead to acne and can increase acne in those patients who are acne prone person. So this patient should take uh, means should prevent by having an professional advice. So in the young age, we can prevent, or we can prevent the worsening of the acne by this. So by the time when they grow, their skin is fine. And many people, they have the habit of just pricking the acne, or they have been told by their friends or that if you poke the acne or prick it the acne, it might heal fast. No, this is not the case. Yes, whenever you prick the acne, it might rupture outside, but it rupture inside also a lot more. So it creates a big damage inside. And when this big damage heals, it will create a big or a complete dark spots, which will take about 2 to 3 months to go away, or it may lead to a permanent scar. And then we have to treat the scar. So it is a very big process. So we should never ever touch the acne. Okay? So this is one of the main prevention thing which everyone should know. We should, otherwise, so there are thousand things which I can tell you, which we
Right.
everyone should follow to prevent the acne, but it depends on individual as an individual. But one of the main thing is do not ever touch your acne. Do not ever
Right.
rub on it. Right?
And I completely agree with you. As you said, that whenever we have acne or anything on our skin or scalp, the first thing we do, rather than going to an expert, which is a qualified dermatologist in this case, will go inside our kitchen and try some home remedies. As you said, besan, curd. I've seen people using lemon, which
Yeah,
is
my
made of.
my one my one friend used lemon for 1 month or 15 days roundabout so on full face and just rub it like hell. It took me about 2 years to get his skin back.
So I think it's really important to understand that if you have acne, you need to go and consult a qualified dermatologist rather than going for home remedies or over-the-counter medication or following an influencer, etc. Now the thing is, again, apart from home remedies, people also go to the chemist shop because it's really easy in our society, and will say that I am having these acne or pimples, koi cream de dijiye, and they'll start using it, and once they feel that the things are now out of control, because initially those creams or ointments, they really work, they seems like they are working and they are working wonderfully, but later on in another 2 months or 3 months, they'll understand that things are going out of their control, and that's when they'll go and approach a doctor. What's your take or advice on that?
Yeah, you are absolutely correct. You are completely informed and knowledge about this. Okay, okay, what all goes first, because many of the creams they are like they will just subside your or redness and you will feel good. Many of time your pimples will subside, but it is just a temporary subside. And as soon as you stop the creams, you will get a sudden flare of it. Hey, and just we said and we discussed that we should always go to a dermatologist. And one should just think that is the pharmacy person or is the chemist person a qualified dermatologist or not? Okay, and not everyone pimples is the same. Hey, not everyone needs a similar treatment. What treatment they need, what side effect can they get, are they in the age of having a baby, are should they need the medicine which should will get a side effect or which should affect their baby, yes or no. There are lots of factors to cover. So it's just not like go to a chemist and have a beautiful full face and after 6 months and there are some creams which will make you shine like your skin was not like ever before, but after 6 months you will get a permanent dark skin. And when such patient comes to us with that permanent dark skin, we just have to say that sorry, we cannot improve you by 10 to 15% or 10 to 13% because this cream has caused you permanent damage.
Right. So don't, waste your time, don't waste your energy, don't waste your money, and keep on worsening your skin condition. At the very first place, viewers, in case you have anything, acne breakout, or any problem related to skin or scalp, please go and consult a dermatologist. That's the, takeaway from whatever we are talking with our doctor today. And doctor, one more thing, whenever we talk of acne, okay, we have already spoken about the prevention part, but we will also like to understand what are the treatment options available? How do you treatment, or what treatments do you recommend for acne?
Uh, Treating acne is just like we treat something else or we repair something. So we just start with suppose someone is having a mild acne. So we will start with applying just a small creams. That's it. And if that is taking part of the acne, then we don't need to even give the medicines also. So small creams directly on the acne or face wash if they are having the mild pimples. Okay, then we proceed if they are having a little bit more acne or if it is not controlled by this, then we can add a little bit of antibiotic for 5 to 10 days along with different creams or face wash or just change it. So the second part goes like this. Third part, if they are having a severe acne, we can increase the dose of the medicine or we can go give it for a long period or we can change it to the different medication. Then there are other treatments also like chemical peel treatments, which are very safe if done by a dermatologist. Yes. If done by a dermatologist, they are very safe, in which the dead layer of the skin is removed and all the pimple glands are shrink. And we can go for that also. Then there are lot of laser treatment also, which will target the pigmentation acne. So it is just a step-by-step process. So whenever someone says, okay, how much will be the cost of treating my acne? So it is not like a holistic approach or whole approach like this. If you are having a few pimples, or if you are having just mild pimples, I will give you a cream to apply in the morning and apply in the night, have a face wash, and your face is clear, it's fine, you're done. And if you don't get more pimples, or if you are comfortable with this, and in 1 or 2 days your pimples goes away and your skin stays fine, then fine, you don't need to come to me also. Just enjoy the life.
Right. And let me know if I'm correct or not. I think it also depends on when you approaches the doctor, at what point of time, how much time have you already wasted on home remedies or over the counter medication, or how much harm you have already done to your skin. That can actually make the treatment lengthy, right, doctor? So it's always
Yeah,
advisable to go to the
yeah.
doctor first.
We talk now, prevention is better than cure. So as
True.
early as possible, or and everyone knows that, okay, this is the age period in which we will get a pimples or acne. So as soon as one pimple occur or some occur, you approach it, or no
Mhm.
problem. Whenever you get to realize, okay, okay, I should go to a doctor, just stop everything, go to doctor, don't think anything else, and follow his advice. You will surely get that improvement result, and no problem. Even if the permanent scars have formed, you will get 70-80% improvement in scars also.
Right. And are acne of various types? Because many a times people have, small acnes, or people may have, big, really big bumps or acnes, which have pus in it as well. So are there various types of acnes as
Lot of types of acne,
well? Okay.
from minute small acne to a big acne, full with cyst, full with fill with pus and everything. So treatment varies according to the type of acne. So just when I
Mhm.
said now, first part, second part, so it was for the different types of acne. First part means the mild acne, then little bit bigger acne. Then if you have just comedones or blackheads or whiteheads, then they don't go away with the medicine, and so we need to do some treatment to get it out. So various type of acne, and treatment varies accordingly. It requires a lot of science and lot of studies and lot of experience to the treatment. So I hope everyone understand this, that it is all about experience and studies and everything, so much hard work. So you just go to a doctor and get everything in just one hand in just
Exactly.
15 minutes. So means it's so easy here in our country.
Exactly. I completely agree with you on that. And one of our viewer here, Neha Chaudhary, she is having these pus acne on her face, scalp, and groin area. She has consulted with many dermatologists. They have prescribed medicines. Pimples stop for short period of time, but when she quitted those, taking those medicines, they start appearing again. So she is asking for your suggestion, doctor.
Yeah, few people have some kind of condition in which their pimple glands are continuously active only. They do not have kind of a mild pimples on it. So they are continuously active only. So in that, we just subside the acne first, and then we try to shift them only on application of the creams, which will have them pimples subsided it only. Because few peoples rarely they have that conditions in which the pimple glands are continuously active. See? So this is means it's a human body. So there are rarer conditions also in which the acne behaves like this. So in that case, we have to behave like treat like this. So just for example, in those patients like diabetes, we have to give long-term medication or we have to continue this. So in few people, we have that kind of treatment in which we then shift them to just applying continuous medication or continuous application. And sometimes and sometimes one of the main treatment which works for them is the the hair and the pimple gland, they are connected together. So when we do the laser hair removal, along with that, in these patients, so they have very excellent improvement.
Okay.
So whenever the hair get pulls, the acne is damaged edge.
Mhm.
So they get continuous acne. Okay. So when we do the laser hair reduction treatment, and then they have a lot of improvement. And then so they don't need oral medicine. So it depends on each and every individualized case also, and what all treatment we can do with it, so that they have the maximum effect with the less side effect.
Right. We have one more viewer with us, Ishita Jha. Now, she is using a particular acne cream, gel rather, and she is asking that can swallowing a little bit of that cream cause any problem, because I'm using a particular cream gel she is using, and she is asking about what will happen if a little goes inside my mouth or into my eyes. Will it create any problem?
Yeah, it will create a problem. It should not goes into eyes and it should not goes into your mouth. But one of
Mhm.
the main things again, which creams are is she talking about? And whenever it is very near to mouth or whenever it is near to eye, we just tell them to apply just little bit dot and apply it about 3 to 4 hours before going to bed, or apply it 6 hours before going to bed and wash it off and then go to bed. So when you are awake, there are very, very, very less chances that it will go into your eyes and in your mouth.
Right. Pooja Pandit is here asking, I'm having fungal infection on my face from last 3 years, have got a lot of treatment, but it is not curing. Recently, there is no ring formation, but little acne-like bumps are appearing on my face. What should she do?
Fungal infection is an infection which is caused by fungus. So
Mhm.
infection can be cured. Infection can be removed from your body. A. So we can remove the fungus from our body if we do proper treatment, and we can remove the fungus from the body. So fungus can be removed from the body if proper treatment is done. And in our means at my clinic and everything, most of all the fungus infection are cured.
Right. So, Pooja, if you resides in Ahmedabad or have any plan to go there, please go and consult Dr. Mansuri. Or in case you are living, far away from Gujarat, then you can go to any qualified dermatologist near your place and seek advice from the doctor.
We
One more
we
thing,
also
doctor.
do online consultation also if she wants to.
Okay,
Or we
okay.
can
So
give
now
advice.
yeah. So Pooja, you have your doctor, and you can definitely consult him online. And doctor, one more thing: we often say that a good or a regular, healthy skincare regimen or routine is really important to keep your skin healthy and to also keep it acne free. So what should we do, especially for acne prone skin people? What should they do on a regular basis?
Regular basis in India, we have a very much of a sunshine. We need a sunscreen, okay? But we need a sunscreen which do not cause the acne. Huh?
Mhm.
So the big thing is which sunscreen to use, which will not cause acne. Now every sunscreen in the market will have written on them, this will not cause acne.
Hmm.
And depending upon the type of your acne, you need to have a sunscreen. So you have to go to a dermatologist for that. I know it will seem like, okay, just for sunscreen I have to go to dermatologist. Yes, you have to. You have to.
Right.
So you need to have a medicated sunscreen or the kind of a sunscreen which will not cause acne.
Mhm.
Okay, you cannot decide, or the chemist can decide. Similar thing will goes with the moisturizer.
Mhm.
Because if you do a mistake in that, or if you can, then you will just end up in getting a big problem, and then you will go to a dermatologist. So it's better
Right.
you go to a dermatologist, ask them, and go. And you need a good moisturizer, and you need a good night cream. And for acne prone skin, you need a two creams, one in the morning and one in the night. That should be with you always. As soon as a pimple pops up, just apply dot on it. It will go away in 2 to 3 days without leaving a mark if it is a small pimple. So that should be a handy with you. And a face wash which will help you in clearing the dirt and also reducing your acne. But these are all, I have to talk to the patient, ask the patient what is she applying, not applying, habits, everything I have to just, and then I can and create a individualized pattern for her. So no one can means one should consult a dermatologist to have their individualized treatment plan or individualized routine.
Right. And as you said that, you need a cleanser, you need a moisturizer, you need a sunscreen, and you need a night cream. And it depends upon your skin type or various other factors that it's always advisable to go and consult a doctor. They'll help you in choosing the right one. Otherwise, what happens, because there's so much of marketing gimmick, etc., that we keep on trying products, and actually they have this side effects on our skin as well. So it's always advisable, save again on your time, money, energy, and consult the right person to choose these products.
Even
But
before,
yes, doctor.
even before when I was a doctor, the
Hmm.
products which I was using before, just like everyone was, I was also same person, and I used to go to market and used to choose this, and I used to get pimples, and I was so frustrated and all this, and and then and and same product where they are at present also they are the same product. So now I realize, okay, I should not have used that. Or
Right.
the main thing is stopping to use that product have stopped my acne.
Oh, wow. So we have a real life case,
So it depends
right
which
here.
product you need. Mhm.
Yeah. So you need to go and consult a doctor and
My parents took me directly to the dermatologist, straightforward,
oh.
on one or two acne. Let's go.
So I think that's what we all should do. We should go to the right person, which is a qualified dermatologist. Now, again, doctor, as you said, cleanser or face wash is important, moisturizer is important, sunscreen is important, etc., etc. But the thing is, with face wash, acne-prone skin or people who have oily, skin type, they'll always say that maybe I need to wash my skin as often as possible or wash my face as often as possible because it will make my face, oil free and thus acne free. Is it true?
Our skin needs oil, some amount of oil, so that it is not dry and it stays live and does not become dead. So we need to wash our face 2 to 3 times a day only, maximum 4 times, and just
Mhm.
very, very lightly wash it and dry it just like that. Okay, that's it. 2 to 3 or 4 times max. Okay, no more than that. If you wash it more time, the oils which are needed for your skin to be moisturized, they will also wash away. The skin will become dry. It will become little bit more acne prone also, very dry, very problematic, won't be even tone.
Right. And in the same way, with moisturizer and sunscreen, like I already have a oily skin or I am also acne prone. So why would I need moisturizer or sunscreen? Or I just don't go out. My exposure under the sun is very less. Why should I use a sunscreen? I'm sure you must have gone through all these, complaints, excuses, etc.
Daily, daily.
Right. So what's your take again, doctor? How do you convince people that why they are important?
See, sunscreen, so they are important because we get the sun rays, and if you in the technical sense, the ultraviolet C rays, they get reflected and they can come through the windows also, and they can
Mhm.
make our skin dark. So we need a sunscreen even if we are indoor. So we are not telling you apply every 3 hours or 4 hours. Apply it twice a day. If not possible, apply it once a day sunscreen. But that sunscreen again also should be the one which is not causing the acne. That is one of the most important thing. And some and I told you ना even if we are indoor, sometimes we go to the
Mhm.
terrace, हम लोग चले जाते हैं ये तो सब लोग टेरेस पे घूमने चले जाते हैं, बैठने चले जाते हैं, ये हमारे यहाँ लोग हम क्लोथ्स ड्राई करते हैं, बालकनी में ड्राई करते हैं, we get little bit of sun, and sometimes the sun heat is so much now, even for 5 minutes or 2 minutes it will just burn your skin.
Mhm.
And once the skin is burnt, in 2 to 3 days it will, in one day it will become little bit red, after 2 to 3 days it will become dark, and again it will take about 15-30 days to get back your own skin. Until then, if you are not having a sunscreen, so the process goes on, and you will have
Right.
a dark skin.
Right. And Dr. Radhika Shukla is here, a viewer, and she's asking, does diet and family history affect acne? And I would like to add to her question. Is it true that milk and dairy products aggravate acne breakouts?
Milk and dairy products, some researchers have shown that cornflakes and have little bit of acne prone
Mhm.
on capabilities, but not that much. Okay. the research are not able to prove complete that exactly that those who are having it, they are having acne. No, in some people it does, in some, but little bit probability high. So this is the answer to your one question. What was your other question?
Does diet and family history affect acne?
Okay, the family history. Yeah, so if the person is having the family history of this hormonal issues, and then this family history comes down. Um, it is not because of a infection or transition, or well, this family history can come down. It is not like 100%, but can come down. But then also it depends on the what the family person took treatment when he or she had acne, and what this family person will take the treatment when he or she will have the acne,
Right.
and which dermatologist will they go.
Hmm. True. And as you said, acne is one problem, acne scars are one problem, and many a times treating acne is, seems to be easier than treating the scars. Now, we have a viewer, Suman Yadav. She is asking, how can I permanently remove these spots of acne from my face? And she also have melasma as well. So, how to get rid of all that?
Spots, so they are on the superficial skin layer. So once the skin is replaced, the spots will go away
Okay.
forever. If
Mhm.
there is no new acne, or if there is no more pricking, no more spots, then no more acne, no more spots. Or if there is an acne, you don't prick, it's fine. You won't get a spot. The spots are temporary thing. Melasma is because of a hormones. It is not related anything to acne. It is a different kind of hormones which causes acne. Most of occurs after pregnancy or in females around 40 to 45 years, and similarly in males also around 40 to 45 years of age. Similar, a butterfly type of rash occurs on the cheek area. This is because of hormones. Hormones continuously produce the pigments. We can control it by 70 to 80%. And this is the fact, like, with everyone who has melasma. There are few creams which will make it 100% go away. I tell this thing to every my patient. If there are few creams which will make it go away 100%, but after 6 months, 8 months, 10 months, you will get permanent blackness. So we will never go in that cream. There are creams which will have you improvement for melasma 60 to 80%, but every time your skin will become good, but there won't be any permanent side effect. So we will always go into this one.
And we'll take one last question from our viewer. Palak Dubey is asking, can aloe vera be used to cure acne in teenagers?
Okay, home remedies. How does home remedies damages the skin or acne? See,
Hmm.
suppose you take a lemon. Suppose you take an aloe vera. Lemon has a vitamin C. Okay. Now, suppose 1% of vitamin in C is needed, and it is there. Apart from them, there are also very much harmful products in the same aloe vera product also, and in the lemon also. Now, for just 1% or 20% important thing which you want to apply on your face, you are along with it applying the 80% thing which is not needed also. Oh, and whenever we apply all this thing in the cream, we are applying the same thing only. Vitamin C, aloe vera, they are only used. But this thing goes into laboratory, they are sterilized, the important constituents are taken out, they are mixed in the creams by which they can go directly into the skin. They are mixed with the preservative so that they are not damaged and everything. Then we can apply on our face and everything. But if you apply directly on your skin or face, it will create a lot of damage. So just few hours before only, I gave an example to my patient on how is home remedies is and how is a good cream differential and how can you compare it. It's like doing home remedies is just like drinking a tap water, which is not pure, not clear. And applying a cream is like drinking RO water or boiled water.
You have explained it so well. I'm sure Palak and all the other viewers have got the idea. And doctor, before we wind up, any take-home message for our viewers?
Take home message: never touch your acne, never believe on all the videos which are just you are daily watching at night. Many people they just make the videos so that their views are increased when many of them have not followed the same thing. I have I have many clients, or you can say patient, or who have taken treatment from me, and they have got their face completely improved, and they have got onto the social media and advertise with different things. This made me improve. And then I've
Right.
just told them, I'm not going to treat you now from.
Right. Yeah, so we should always, refrain from using over-the-counter medication or home remedies, or going by what the influencers are saying. A lot of economy or economics is also involved there. So try to understand that trap as well.
Yep,
Thank you
we
so
are
much.
we are
Yes, doctor.
doctors. We are doctors. We have to
Yes,
take care
yes,
of ethics. Patient is
yes.
a patient is a responsibility for us.
Right, exactly. And you have studied skin types, etc. You know exactly what our skin needs individually. You can treat our problems, and that's why continuously we are trying to convey the message that in case you have any issue with your skin or scalp, please go and consult the right person, which is a qualified dermatologist. Thank you so very much, Dr. Mansuri, for your valuable time. It was wonderful hearing you, and this was a very informative session. I'm sure viewers will, use the information correctly. Thank you so very much.
Thank you very much. I always love this kind of talk and everything.
And we really look forward for many more such sessions with you for our viewers in coming time. Thank you.
Sure.
Thank you, viewers, for your active participation in today's session. And that said, stay beautiful, stay spotless, and stay connected with us. Thank you. Goodbye.